We are here with Benoit Abeloos from the European Commission. Benoit is the Policy Officer for Standardization and Interoperability in eHealth. Good morning, Benoit.
Good morning.
Tell us a little bit about your role as a Policy Officer within the European Commission.
Okay, I'm part of DG Connect, which is the Directorate General in charge of technologies, Internet, ICT, etc., within the Health and Wellbeing Unit. So we have a lot of activities. We're financing research and innovation, and as well we are doing a policy together with colleagues from Sanco. And within the policy field, I'm more in charge of standardization and interoperability, which are important subjects and which is one of the barriers for the deployment of eHealth systems. So it's important to tackle that issue.
Mm-hmm. Can you talk about some of the progress within eHealth that has been made so far in Europe?
You know, the Commission is busy with eHealth for many years now, and we're seeing progress one of the biggest progress, I would say, was following the putting in service of the Patients' Rights Directive. We have set up the eHealth network of member states, which are now meeting twice a year. There will be a meeting tomorrow of the eHealth network, and where the member states are sending high-level representatives to really discuss, cooperate, and decide on different issues around eHealth deployment. And that's where really we try to have a coherence and consistency within Europe on eHealth deployments on several topics, one of them being standardization and interoperability. And having the member states really working together, agreeing on common decisions is very important and is an important way forward.
It also must be a huge task to do such a thing.
Yeah, absolutely. Because there are different levels of deployment and maturity of eHealth systems in Europe. So we need really to align all the people. And in terms of standards and interoperability, I mean, different choices may have been done in different countries. So alignment and convergence and coherence of all of that is a task, but we're progressing in that.
Mm-hmm. Can you talk about what developments there are in terms of interoperability and standardization? What should we expect? What are some of your challenges? What should we expect to see in the near future?
One of the big investment we've known in the past and which is finished now is a big pilot project, a large-scale pilot project called EPSOS. It's going to finish in June, and it has delivered. I mean, they have set up an eHealth interoperability framework. They agreed on standards and interoperability specifications to exchange health data across the border. Now, this project is going to finish. From that project, we already had the decision of the eHealth network for guidelines on a patient summary coming directly as a result of the EPSOS project. And now the next steps after piloting is large-scale deployment. So we intend, through the Connecting Europe facility, to give some funding for eHealth deployments for cross-border infrastructure in order to be able to exchange health data across the borders. So that's one of the next steps. And of course, we are going to work together with the eHealth network and all the different projects working in the area of interoperability to be able to do that properly.
Mm-hmm. So if, let's say, I'm a Greek citizen who's traveling, let's say, to Belgium, and I fall sick in Belgium, through this project, I should be able to get care and my prescriptions filled?
Yeah, I mean, that's exactly, and Greece is a good example because it's one of the good students because it is piloting within EPSOS and has been really active within EPSOS. So, and yes, the idea would be that if you fall sick, if you're traveling or if you're settling in another country, that the doctor who's taking care of you can access your patient summary or your e-prescription if you are at the pharmacy to get your drug or to get the good treatment if you're with the doctor. So that's the idea, yes.
Mm-hmm. Can you talk about the implications in data protection and privacy that such an initiative has?
Yeah, of course. I mean, that's one of the key aspects of what we're doing. When you talk to the people in the streets with friends, etc., about what we're doing, the immediate first thing they say, yeah, but what about privacy? So, of course, and that was one of the big tasks of EPSOS as well. You need to put in place the processes and the security architecture and infrastructure and processes and the security standards in terms of encryption, etc., to make sure that only the one who needs to see the information sees it. And it raises as well not only data protection issue, but identification issue. You need to be sure that the doctor who's in front of you identifies and can prove that he is a doctor so that he can access your data, and only for the purpose for which he's treating you. And you, as a patient, we are pushing as well for patient access to the electronic health records. It's important as well that you are identified in a secure way so that nobody else can access your data.
Mm-hmm. How is mobile technology impacting interoperability?
I mean, everything is getting mobile, including eHealth. People are monitoring themselves, whether it's for their well-being, to see how their health evolves, etc., to see whether they're eating the right stuff, etc., in terms of nutrition, or when they're doing sports, etc. And of course, they're downloading applications. There are tens of thousands of applications available in the area of health. And of course, we need to take that into account because it's a burgeoning market. It's a growing market as well, and you have the possibility as well to use mobile devices as medical devices as well. So all of that need to be ruled, and in terms of security and safety as well, we need really to have the proper action. Hence the green paper on mobile health.
Okay, and from what I understand, you're also involved in the cooperation between the European Union and the United States. What should we expect from this collaboration?
Yeah, that's a good question. Yeah, absolutely. The Commission has signed with the Department of Health and Human Services of the US a memorandum of understanding in 2010, and we're working on the implementation on that. One of the two priority chapters is interoperability and standardization. So we have direct talks with the US, and we are working on a pilot project as well of US citizens traveling in Europe or EU citizens traveling in US and having access to their patient data as well, being able to download and translate their patient data so that they can show that to the doctor. Same idea than Ipsos, but of course here, as we're working with a country which is outside the EU, the issues we've been talking about, privacy and identification, etc., are even more important, but we are addressing them. And of course, we need as well to align. I mean, we have the EPSOS project, which has set up an interoperability framework. We have to do the mapping between the interoperability and standardization choices that have been made in Europe with the ones that have been made in the US, so that we can really exchange in an interoperable way.
Mm-hmm. What's the typical time frame for such a pilot program to be concluded?
There will be a session here in Athens on Wednesday showing the progresses, and I've been talking about mapping. So the mapping has been done between the terminologies and as well the messages, the format of the messages, and we're going to show that. The time frame, I mean, we're trying to progress as fast as possible. We hope to be able to pilot next year, so that would be an important milestone.
Mm-hmm. Wonderful. And I understand you're also presenting at several different sessions here, and you're part of the eHealth Forum. Can you tell us more about the sessions, and also what are you personally hoping to gain from your participation at the forum?
What we gain to participate is to have feedbacks from the different stakeholders. Of course, we meet them on a regular basis because we're financing projects, pilot projects, and as well we have a eHealth stakeholders group which we are financing as well, and which we meet. But of course, here is really the opportunity to see everyone at the same time and to have a kind of a big, huge brainstorming and to really try to see where we are with the different stakeholders and to learn what would be the next steps and what we could, as a European Commission, do to make things progress. Mm-hmm.
And one last question, looking ahead, let's say in the next 10 years, how do you foresee that this healthcare sector, and specifically eHealth, will change?
As I said, I mean, the Commission has been working for 20 years already, so in 10 years there will be still a lot of work to be done. That's what is good with that sector as well. But I'm sure, I mean, as I said, we have now everything in place. We have the Health Network, the Connecting Europe facility, and different other instruments in the area of standardization, the multi-stakeholders platforms, etc. We have really instruments to be able to go forward. So I bet that in 10 years from now, eHealth systems will have been deployed in Europe, and that most of the citizens will have access to the electronic health records.
Wonderful. Thank you very much, Benoit, for your time.
You're welcome. Thank you for the invitation.
Folks, that was Benoit Abeloos from the European Commission. Benoit is the police officer for standardization and interoperability in eHealth. Thanks again.